by more than a third in one day in the UK. They went up from 590 to 798 in one day. And then this is from Belgium. This was also posted by Worldometer. 160 new infections. Yeah, so the number of cases similarly, actually, the number of cases in Belgium went up by about 40%. There were about 400 cases in Belgium yesterday, and they had 160 new cases today. So the number of cases in Belgium went up by about 40%. So we've seen in a number of European countries today, the number of cases go up by a third or more in one day. That's not good. Oh, and there's a Greece number too. Worldometer said 73 new cases in Greece. Malls, cafes, bars, eateries to close as coronavirus cases rise to 190. So the cases in Greece went up about like 60% in one day too. Health Ministry representatives say all malls, cafes, bars, and food outlets will close, though supermarkets will remain open. Wow. Malls, cafes, bars, and eateries to close in Greece. So two trackers I like. I like both of these trackers. This is the bnonews.com tracker. They tell you different countries, what the cases are. You can also get all the different states of the U.S. If you go down here and you click on USA, you actually get the USA state totals. The New York, this is a little old though. New York is now up to 400 something. They also, both of these sites post links at the bottom where you can see like the case updates. They post links. 190 new cases in 5 new deaths in the Netherlands, links. 136 new cases and 28 new deaths in Spain, link. This is bnonews.com is where you can get this one. And then Worldometer, if you Google Worldometer coronavirus, that'll get you to this one. And they post new cases and links and all that too. So I use both of them. And they're saying there are 142,897 cases. So I'm going to update my number here. Okay. So we have just 43 minutes until President Trump's press conference, just 43 minutes. That is what we are waiting for. COVID-19SD says Danish borders will be closed tomorrow. Danish borders are closing. Denmark. The Danish borders close as a result of coronavirus. Closing lasts till April 13th. All passenger traffic closes to and from Denmark at Saturday at noon. Danish borders are going to be closed to people. All tourists and foreigners who cannot prove they have a purpose in Denmark will not be allowed to enter Denmark. Danes will always be allowed to enter Denmark. Wow. That was posted by COVID-19SD. And it was that story is from Ekstrabladet. Ekstrabladet is the ones who ran that story. Yeah, see, look, same thing. Prime Minister of Denmark says borders will temporarily close due tomorrow from tomorrow due to the coronavirus pandemic, but Danish citizens will still be allowed to enter the country. All right, hang on 1 second here. Hey guys, I just need 1 minute. Give me 1 minute. I will be right back and we will continue our live coverage in 1 minute. All right, we are back. And in 37 minutes, President Trump is going to be giving a news conference, and we will be bringing you that live coverage of President Trump's news conference. Oh, all Louisiana schools are closing. All Louisiana schools are closing. So another U.S. state has closed schools. All Louisiana public schools close. Hmm. Special Teams 49ers sent me this. What are they going to do here in Santa Clara? Santa Clara County already ordered no events. Oh, I bet they're going to like cancel school. Santa Clara County already ordered no events of 1,000 people or more. So now they're going to have new orders. My guess would be that they're going to cancel school in Santa Clara County, California. That'd be my guess. Maybe we can check it out right when it starts. Oh, when is that? Yeah, so it's like in 5 minutes. So I'll check it out when it starts. Oh, I missed this. Thank you, JP. I had missed this. 79 new deaths. 79 deaths in France. 79 deaths in France, and almost 800 new cases. Oh no, is that hold on, I'm sorry. That's not necessarily new death. Is that new? Is that new or total? That might be total deaths. I'm sorry. This is unclear. It might be the total number of deaths, 79, not new deaths. Let me see if I'm sure I can get an update on that. It's a little confusing. 18 new deaths. There you go. I apologize. I misread the tweet. It was a little confusing. So 18 new deaths in France. 79 total have died, and 785 new cases. So that's a lot of new cases. Their number of new cases has gone up by about 30% in one day. So we're seeing these huge leaps in cases all around Europe. Italy, about 2,500 cases, 250 deaths, hundreds of cases new. Spain, I think, was over 1,000 new cases, hundreds of cases, a couple hundred cases in the UK. So we're just seeing these big jumps in cases in Europe. Wow, and a number of deaths as well. And remember, if you're in with the U.S., these countries are much smaller than the U.S. is. I think France is about 1/5 the population of the U.S. So if the U.S. sees these kind of this kind of rate of new cases, the numbers could be 5 times higher than this because they just have more population. Thanks, by the way, to AC and Kevin Helseth and John Dildy and Max Videos. Yeah, we just talked about Denmark closing their borders. Marty, thank you, Marty. Rita Grayson, thank you. This is interesting. New York City Teachers Union calls on the New York City Mayor de Blasio to close public schools. I guess the teachers might be concerned about getting coronavirus. Thank you also, William Cook, for your support. Thank you, William. The oil factory says almost 50 miles south of Seattle, almost every shelf at the local Walmart is completely empty. That's from the oil factory. Oh, I didn't know this. Smugly sent me this. Smugly 58 new coronavirus cases in Qatar. Almost all the new cases are related to the cases identified earlier and are in quarantine. So the Peninsula says, let's see if it actually opens. I assume this is accurate. According to, this looks like an AFP article. 58 new confirmed cases in Qatar. Okay, let me look this up also. See where this is coming from. I'm not familiar with that publication, so I'd like to double check that number. Because I don't know that the Peninsula, but I believe it. Does Worldometer have it or BNO? Let's see. Worldometer has Qatar at 262. Hang on, I might be able to get that somewhere else. Get that information. How about here? Let's see. So I'll consider that an unconfirmed report of 58 new cases. It looked legit to me, though, but I don't know for sure. Oh, and then this is, which is this Ministry of Health? Is this Kuwait? What is this? Saudi Arabia. Oh, Saudi Arabia. It looks like Saudi Arabia reports new cases. Saudi Arabia, 24 new cases in Saudi Arabia, bringing the total number to 86. They had, yes. Not capital. So the number of new cases in Saudi Arabia just went up by about 40%. It was at 62, and they got 24 more. So percentage-wise, that's a big increase. Well, I will consider the Qatar number likely but unconfirmed at this point because I can't find confirmation of it. Hey, we only have 27 minutes until President Trump's, oops, I was going to go to Santa Clara County. 27 minutes till President Trump's news conference. Let's see what Santa Clara County is saying. Did they already say it? They just started. Santa Clara County is just south of San Francisco. That contains Silicon Valley. So they're supposed to do some kind of announcement in Santa Clara County. Here we go. It looks like, maybe.
Stages anyway.
Yeah, this one.
But I can go like that.
And they have already banned events of more than 1,000 people. Santa Clara County. South of San Francisco. It includes Silicon Valley, Palo Alto, Mountain View, Sunnyvale. They have not started yet. So we'll check that out just to see what they say when they start. No, they have not started yet. So we'll check that out. Oh, I should have mentioned, I'm a Knucklehead mentioned this. I tweeted about this earlier. Ted Cruz said Ted Cruz is still self-quarantining because he had contact with a second person who possibly had it. Is that what it was? Let me see. I forget what the actual statement was. Let's see here. I have to go back here. Ted Cruz to extend, Jamie Dupree says, Ted Cruz to extend his self-quarantine after finding out he met with someone else who now has the virus. My self-quarantine ended yesterday afternoon. I still have no symptoms and feel fine. I was looking forward to taking my family out to dinner tonight. Unfortunately, last night I was informed I had a second interaction with an individual who yesterday tested positive for the virus. Yeah, on March 3rd, I met in my DC office with Santiago Abascal, the leader of the Vox party in Spain. So he met on March 3rd with a Spanish politician who now has coronavirus. So he is now going to isolate himself again. Even though the politician was asymptomatic at the time of the meeting. And several days after our meeting, he had extended interactions with another individual who has tested positive. Oh, hang on a second.
Jeff Smith, CEO for the County of Santa Clara. County Sheriff Lori Smith. Tim Davis, Assistant Sheriff. And Dr. Sarah Cody, County Health Officer and Director for the County of Santa Clara Public Health Department. And with that, I would like to introduce James Williams.
Good morning. My name is James Williams. I'm the County Counsel for the County of Santa Clara. First of all, I want to begin by thanking all county residents who are following and adhering closely to the guidance of our public health professionals and our public health department in practicing social distancing, in taking action individually and in their families, in their businesses, and in their communities to keep each other safe and keep our community safe as we combat COVID-19. The entire county organization has been mobilized in response and to support our public health leadership in Dr. Sarah Cody, our county health officer, and our other public health professionals. Dr. Cody and our public health professionals are providing us with calm, thoughtful, but aggressive steps that we need to take in order to deal with COVID-19 in our community. And our county and public health department is working in close coordination and collaboration with a number of partners, including our County Office of Education and County Superintendent Mary Ann Dewan, our cities, including the City of San Jose, our state and federal partners, including many members of the CDC who are embedded in our Emergency Operations Center and in our Public Health Department Operations Center. There are extraordinarily difficult decisions with very difficult trade-offs that have to be made by our public health professionals. And they have to make these decisions based on limited information about COVID-19 and with limited time, because the time to act is now. And it's in that context that today Dr. Cody is announcing a new order banning gatherings of more than 100 persons and imposing conditions on gatherings of between 35 and 100 people, and that County Superintendent Dewan is making an announcement regarding the closure of schools in Santa Clara County. I'll now turn it over to Dr. Cody, our Public Health Officer.
Thank you. Good morning. As you know, my name is Dr. Sarah Cody. I am the Public Health Officer for the County of Santa Clara. Thank you all for being here this morning. As of 8 p.m. yesterday evening, 79 cases of COVID-19 have been confirmed in the County of Santa Clara. That's 36 more cases than I reported on Monday when I announced my initial legal order, and a more than threefold increase in the last week. Of these 79 cases, 43 represent community transmission, meaning the cases are not linked to travel or close contacts. 37 of our cases are hospitalized. Based on these data and patterns of disease that we see around the world, we know that the outbreak of COVID-19 in our county will continue to accelerate, and we anticipate many, many more cases in the days and weeks to come. To further protect the public, I have decided to take additional aggressive measures. These measures are designed to slow the spread of disease and preserve critical healthcare system capacity and other essential services. Slowing the spread of infection is especially important for hospitals and healthcare systems so they can maintain their capacity to take care of all patients, whether or not they are COVID-19 patients. Today, I have signed a mandatory order prohibiting public or private gatherings of more than 100 people. This order will take effect at 12 a.m. tomorrow, March 14th, and will remain in place for at least 3 weeks. We are also banning gatherings of 35 to 100 people unless organizers implement 5 specific measures to reduce the risk of COVID-19 transmission, such as preventing anyone who is sick with a fever or respiratory symptoms from attending, and ensuring that those who are at higher risk for serious illness do not attend. So to clarify, a gathering is any event or convening that brings together people in a single room or a single space at the same time, such as an auditorium, stadium, arena, conference room, meeting hall, cafeteria, theater, restaurant, bar, or any other confined indoor or outdoor space. This ban does not include normal operations at airports or places where people may be in transit, office environments, classrooms, medical offices, hospitals or clinics, or retail environments like pharmacies or grocery stores. In addition to this legal order, we have updated our guidance and posted it to our website. Today's guidance also includes updated recommendations for workplaces and businesses, people who are especially vulnerable to severe illness, and the general public, as well as a statement regarding schools, which Dr. Dewan will address shortly. We strongly urge that people who are at higher risk of severe illness stay home as much as possible. Do not travel on cruises. Avoid air travel unless absolutely necessary, and follow all guidance for the general population. I recognize that we are in very difficult times. These decisions are hard to make. We are balancing the public health need to slow the spread of infection with a significant impact we know these actions will have on the lives of our residents. We believe these actions are necessary to protect the well-being of our community during one of the most historic public health challenges of our time. Once again, I just want to emphasize the incredible importance of everyone doing their part to protect the community, to slow the spread of disease, to protect those at greatest risk, and to enable our healthcare and other workers to provide essential services for all of us. Thank you so much.
Good morning. I'm Dr. Marianne Dewan, County Superintendent of Schools. As County Superintendent of Schools, along with the District Superintendents of Santa Clara County, have determined that public schools in Santa Clara County will close to student attendance beginning March 16th through April 3rd, 2020. This decision was made after extensive consultation with the Santa Clara County Department of Public Health and the Center of Disease Control. Staff will be on paid status, on call, or on duty during this time per their local district guidelines. District offices will remain open for essential services and operations, and all essential personnel shall report to work. The decision to close schools to student attendance is a serious matter. Our goals at this time are to develop plans for schools to implement this most recent guidance of the Department of Public Health and the CDC as it pertains to school settings, to assess the needs of our community, and to take all reasonable steps to reopen schools to student attendance as soon as possible. Students and community members should adhere to the social distancing guidelines and avoid congregating in public places.
Okay, so we've been watching Santa Clara County, California. So they have banned events of more than 100 people. That is the lowest number of people banned I've heard about in the United States. Santa Clara County has banned events of more than 100 people, public and private events. There's also something where if it's between 35 and 100, you have to take certain precautions if you're going to have the event. Also, they're closing their schools as well. Let me just hear what this next speaker is saying real quick.
Diverse, impressive, smart community we live in. We live in the center of innovation. We are one of the most diverse places in the.
So I want to. We need to get off of this because soon we're going to go to President Trump's press conference. But also, something I really noticed. I'm guessing some of you noticed it too. When the health official was talking about the new regulations, including the ban on 100 people, and she started talking about how they're now 70, about how this is going to get worse in Santa Clara County. She actually seemed to get very emotional and start tearing up and like crying a little bit, like she was kind of holding it back. But it was a very emotional moment when the health official was talking about the measures. The new measures in Santa Clara County. She actually did seem to tear up a bit and start to cry a little bit while she was making this announcement, which is concerning. I mean, she certainly, she's saying that this is going to get worse in Santa Clara County. They currently have 79 cases, 43 of community spread, but she says it's going to get a lot worse. So that was certainly noteworthy. So anyways, but that is the first United States county I've seen, or municipal area, put a ban on events with that low number of people. More than 100 people, public and private events banned, gatherings banned in Santa Clara County. And again, Santa Clara includes Silicon Valley, Mountain View, a lot of big tech companies in Silicon Valley. Mountain View, Sunnyvale, for example, Palo Alto. So that was certainly Goodwitchy says maybe she knows people with the virus. Maybe that's why she's crying. I don't know why she was, but she clearly got very emotional about it. And I've seen her talk at pressers before, and she hasn't done that before. So that was certainly noteworthy. All right. So in 15 in how many minutes here? 12 minutes, we're supposed to have this press conference with President Trump. President Trump holds a news conference. So we will be bringing that live to you. Also, hey, I want to say a quick thanks to our moderators. Thank you to Luke Emtech for moderating. Luke Emtech is there. And is it just Luke? Becky Scarlett is there. Thank you for moderating there. Also, Linda Belk in our Periscope chat is moderating. Sharon Craig, Misha. And our other moderators too. Sorry if I'm missing moderators. Katsy is there. Thank you, Katsy, for moderating. And our other Periscope moderators. Also, our Facebook moderators like Denise Fredrickson and Shay Durner have been in there. Also, Courtney Lane, Kimberly Peterson, and Joe Serino, Dan Lindquist, and our Twitch moderators too. Moderators such as Daily Disclosure, Matthew Johnson, Idaho Star, Keisha Umaroth, Callie Smoke, Love Pugs, XXD, and others. Thanks to all of our moderators. And thanks for your support. Chippy Neal and Shermanator And AC, thank you. Okay, so again, we are getting very close to President Trump's news conference. Which we will bring you live. Two countries in Europe have closed their borders. Poland closes their borders, suspends international commercial flights. Denmark also temporarily closes borders to foreigners. So I believe the idea here is just to try to slow the rate of spread of the virus. That's from B&O Newsroom. And President Trump is expected to declare a national emergency in his 3 p.m. announcement, which articles we've been reading say would allow funds, for example, to be used, more funds to be used to fight the coronavirus. Here, like Trump expected to declare national emergency. Trump will declare national emergency. The state of Louisiana has already announced it would delay its primary. Trump will declare national emergency, New York Times. President Trump is expected to declare a national emergency, a move that would give him authority to use $40 billion allocated by Congress for disaster relief to address the coronavirus crisis. Cases in the blah, blah, blah. Mr. Trump is expected to invoke the Stafford Act, a law that empowers FEMA to coordinate disaster response in state and local governments. The details of President Trump's announcement, another official cautioned, were in flux and being finalized at a 3 p.m. news conference. Maybe he'll announce something else. Who knows what he'll announce? Also, Louisiana will postpone its upcoming presidential primary election for 2 months. So again, that is in about 8 minutes that's supposed to start. Give me a shout if you have comments, questions, updates. At Lookner on Twitter is where you can reach me, at Lookner on Twitter. I'm just checking some different updates here. Sorry, there's just a bunch of things to check here. So I'm just going over some different things and messages and sources here. What is the stock market at right now? The stock market's up a bit today. It's up quite a bit. I think maybe in anticipation of some more a federal stimulus. Well, 3.86%. Oh, that's sorry. Dow Jones is 3.5%. That's the Dow Jones in the U.S. How about Europe stocks? Europe. Yeah, good day. I mean, Europe stocks, France 1.83, UK 2.46, Germany 0.77. So better than it has been. How about Bitcoin? Bitcoin went down like 40% yesterday. What's that at? It went up a bit. It was at 4,500, I think, or something yesterday, one day. Oh, it actually got down to around 4,000. It's close to 4,000. Oops, let me just get this set up here. We are waiting for President Trump's news conference. It's supposed to start at 3 p.m. That's 4 minutes from now. As soon as we'll show you the whole thing, but if I can get video before, if they start showing some video before, I will certainly go to that. Here, look, you can see Steve Herman says, see, look, I don't understand this at all. I'm sorry. Every time I cough, people joke for 5 minutes that I have coronavirus. Yeah, I don't understand. I mean, the press is packed tightly. It's like people are, I find it weird at these press conferences when politicians are tightly packed and press are tightly packed. You'd think there's a way they wouldn't do that. Ivanka Trump worked from home today out of an abundance of caution after she met with the Australian Home Affairs Minister who has tested positive for coronavirus. That's from Finn Gomez. Oh, Intel Crab posted, who I follow, Intel Crab posted, due to high demand and to support all guests, we will be limiting the quantities. Anyways, I guess they're out of a lot of stuff at Target, it looks like. That's disinfectant wipes, hand sanitizer, toilet paper, bottled water. I guess that's what it is there. That's Target, wherever Intel Crab is. Breaking news, 6 San Jose firefighters have now tested positive. 6 San Jose firefighters have now tested positive for coronavirus. That's from Henry Lee. City of San Jose is tracking dozens of others who may have been exposed. 6 San Jose firefighters. That is concerning. The number yesterday was 4, now it's 6. and dozens of others are being tracked. Norwegian Cruise Line has suspended all cruises for around a month. Yeah, I mean, I hope we don't hear about like a big outbreak with the firefighters where dozens of them have it. I mean, we've seen outbreaks around the world, whether it's a church or a call center. There's a call center in South Korea where over 100 people at the call center have been diagnosed with it. Anytime now, we're waiting for President Trump's news conference to start. This is going to start any time now, so when it starts, we will be bringing it to you live. Just so you know, I pretty much can guarantee you will see, if you're watching your TV and this broadcast, President Trump will start on your TV before it starts on this broadcast, because just it takes a delay to get the signal to you, for me to get it to the White House, and from me to you. But you'll see the whole briefing here, the whole press briefing here. So as soon as I have the video from there, I will let you know. We will watch it. Our viewer oops. Our viewer Kelly Powlock says, UW Labs out of pipette tips. Imagine a restaurant without forks. Austin Jenkins says, on the verge of a national emergency, and the call has just gone out to Washington's life science community to rummage their drawers, cabinets, and supply closets for disposal pipette tips so UW can step up coronavirus testing. Apparently, they're in short supply. Thank you, Kelly, for the update. The Golden One says, this was my local Walmart's toilet paper and paper towel aisle about 2 hours ago, 15 miles north of Pittsburgh. There are no confirmed cases in our area at this time. So we are waiting for President Trump anytime now. Oh, is this true? E.J. Kutach says New Mexico has a 100-person gathering ban. I hadn't heard that. Oh, let's see. New Mexico. I didn't hear this. New Mexico banned gatherings of 100 more people. I wasn't aware of that. That is from New Mexico Political Report. So New Mexico has also banned gatherings of more than 100 people. Huh, interesting. Thank you. Hey, thanks Jay Unk and Megan Mills and Jennifer Small for your support. Thank you. Again, President Trump's news conference coming up any moment now. We will bring it to you live. And as soon as it starts, we will bring you the video from the White House. Oh, thank you. I missed this. Thank you, Grace, for sending this to me. Cole Miller says, remember the O'Connell Lodge in Kent, Washington, the county purchased to quarantine those with COVID-19 and coronavirus symptoms. It appears the mayor's fears came true. Her office announcing a patient left. An urgent public safety update. Press conference will be held at 11. Oops, it's not supposed to happen. Mayor Ralph says the patient walked to a nearby business, stole products, and boarded a KC Metro bus headed north. The person was awaiting test results. So somebody awaiting their test result left the O'Connell Lodge facility and stole products and boarded a KC Metro bus headed north. That's from Cole Miller. President Trump is going to start any time now. We are waiting for President Trump to start. As soon as he starts, we will bring it to you live. Governor of Virginia orders all K-12 schools in Virginia to close for a minimum of 2 weeks. That's from Jeff Shapiro. With Richmond Times Dispatch. So Virginia is closing its schools. We are waiting for President Trump. Our viewer Michael Ruiz sent me this. AMC Theaters, the largest theater circuit in the United States, will keep its doors open for now at locations but cut seating capacity by half. President Trump was supposed to start at 3 o'clock. It is now 3:08. Any moment, President Trump is expected to walk out and do his news conference. He is expected to declare a national emergency. Oh, hold on a second. Also, New Jersey has 21 new cases. I think somebody mentioned this to me. I just saw a post that said New Jersey has 21 new cases. "21 new cases in New Jersey." So 21 new cases in New Jersey, 50 total now. One of our viewers said it's 2,000 in the US. According to Worldometer, I have to update, 144014, Worldometer says US cases 2,022. According to Worldometer, They say it's 2,022 cases in the US, 144,014 around the world. That's according to Worldometer. Let me just update our headline. As we wait for President Trump, what is going on? Why did they do that? Weijia Zhang says, don't see any teleprompters in place for the president's briefing, so he could talk off the cuff. We'll see soon. Also, again, look at how everybody is packed in. This seems dangerous, doesn't it? Everybody sitting so close together. I mean, they're all sit. What if one of them has it? I don't know. It just seems. Breaking news. Brazil President Bolsonaro's lawyer, who also traveled to U.S. with him recently, reportedly diagnosed with coronavirus, says Jornal O Globo. Brazilian President Bolsonaro's lawyer has reportedly been diagnosed with coronavirus, and he traveled with Bolsonaro to the U.S. That would be the second person in Bolsonaro's group who were traveling to test positive, because his communications minister tested positive previously. That's from Tom Phillips. Bolsonaro, there were reports that Bolsonaro tested positive. Bolsonaro himself, I haven't seen the appearance. I heard a report that he claimed he was positive in a TV address, and his son, Bolsonaro's son, told Fox News that Bolsonaro had tested positive, but they were waiting for a second test. And then later, Bolsonaro's son told Fox News, no, he never tested positive. And Bolsonaro ended up posting up on his Facebook that he had tested negative. So it's not clear if Bolsonaro has it, but this would be the second person who traveled with him to get it. Again, no teleprompter set up for President Trump. No teleprompter. That's from Steve Herman. I wonder if he'll take a lot of questions. Here we go. A homeless individual who was isolated, we talked about this earlier, who's isolated at a motel while awaiting test results for coronavirus, disobeyed orders to isolate, and shoplifted items before fleeing on a bus. It's from Shimon Prokopets. We're waiting for President Trump. It was supposed to start at 3 p.m. It is now 3:15. A lot of reporting saying this will be a teleprompter-free press conference by President Trump in the Rose Garden. That's from Jeff Bennett. Hey, thank you, Josh Cusiak. Thank you, Josh, for your support. Thank you, Leah Maya, too. Leah Maya. And Danny Henslow. Thank you, Danny Henslow. Danny thinks Trump's going to delay till 4 p.m. when the market closes. That would be a long delay, Danny. Thank you, Rodrigo GRM. Thank you, Rodrigo GRM, for your support. And thanks to all of our moderators, too. Thanks, moderators. So we're still waiting for President Trump. It is now 3:16 p.m. I agree with this. Honestly, it's hard to watch journalists and staff sitting literally right next to one another in the Rose Garden. I was just talking about this. Can they submit questions virtually? It's not at all clear that the message that social distancing is critically important is getting through. That's from Jason Wofsy, retweeted by Intelgrab. I totally agree that it's so weird to see the press all packed in at the press conference. Governor Inslee of Washington is going to be announcing additional school guidelines and other social distancing strategies. Washington already closed schools in the Seattle-Tacoma metro area. So I wonder what the other social distancing strategies will be he announces in Washington. We'll see. Also, I wonder if he's going to. I bet he'll close the school in the entire state. He might do that because they have. I don't think they've done that yet in Washington. They closed schools in several counties. So President Trump, anytime now, we're just waiting for him to start. He was supposed to start 18 minutes ago. We're just waiting for it. As soon as it starts, we will be bringing it to you. But it's not live yet. Eamon Javers says, we saw the president on prompter Wednesday night. Now, there's no prompter. We are in the final hour of trading on Wall Street. So we are waiting for President Trump. Anytime now, he's expected to declare a national emergency about coronavirus. It's interesting. I would have thought for him to have a prompter if he's going to declare a national emergency. But maybe it'll be mostly him taking questions. I don't know. You never know. If he takes questions, he could go on for a long time taking questions. He sometimes does. Hey, thank you so much for your support, Maria Bundo. Thank you, Maria Bundo. I appreciate that. And thank you also, Karsten Moras. Thank you, Karsten. And thanks again to all of our moderators. I really appreciate it, moderators. Thank you. So we are just waiting for President Trump. Again, it's 3:20 p.m. now. We told you before, 2 more San Jose firefighters have tested positive for the virus, totaling 6 cases. 1 additional TSA worker. Oh. So we told you that 6 firefighters in San Jose have now tested positive. A 4th TSA worker from San Jose International Airport has tested positive for coronavirus. So San Jose, which is in Santa Clara County, they've had 6 firefighters and 4 TSA workers now test positive for coronavirus. We are still waiting for President Trump. Still waiting. Steve Healy says Trump is stalling. He's joking. All right, it is 3:22. This was supposed to start at 3 o'clock. We are still waiting for President Trump. And we don't know exactly what he's going to announce. It sounds like he's going to announce a national emergency, but will he announce anything else? We continue to wait for President Trump. 3:23 p.m. now, 3:23. I don't know. What about the viewer who said, our one viewer said he was going to wait till 4 for the stock market to close? I don't know. That's what Denny Henslow says. Maybe Denny's right. Maybe he's going to wait till 4. In case you missed it, some really big numbers from European countries today. These numbers from Italy, look at the deaths from Italy if you haven't seen this. 250 new deaths and 2,547 new cases in Italy just in the last day. It's from B&O Newsroom. Netherlands, 190 new cases and 5 deaths. Cases go up by like a third, deaths go up by like 100%, by exactly 100% in one day. Where's France? Spain. Spain, 1,063 new cases and 53 new deaths in Spain since midnight. Hey, thanks, Kyle, for your support. I appreciate it, Kyle. Thank you. So we are still waiting for President Trump. He was supposed to start at 3 p.m. It is now 3:26. We will have it for you live as soon as he comes out. We'll wait and see. No teleprompter for President Trump. No teleprompter reportedly. Here's another report. No teleprompter set up for President Trump's press conference. The wait has been so long that all 3 news channels are now in a commercial break. Fox, MSNBC, and CNN. I keep one on in the background just to see, because I'll see a little earlier if he's walking out. They're literally, CNN, Fox, and MSNBC are all in commercial break right now. They hope they don't miss the start. No, he has not started yet. And all the press, it's not like all the press hasn't been sitting out there. The press has been sitting out there the entire time. So we are still waiting. It is now 3:28. Was there a 2-minute warning yet or not? Sometimes they give out a 2-minute warning. And then the reporters will say, 2-minute warning, 2-minute warning for Trump, 2-minute warning. So again, if you're watching on your TV, you'll see it on your TV before you see it here because it's a little delay to get you the signal, but we will have the whole presser for you. Here's what I need to do. I need to go here. So that's where it's going to be. It's the White House channel. So it's right there. So we are waiting for it to start. Anytime now. He is not there yet. I can tell he's not there yet. But they just said 2-minute warning. All right, he's walking out. So I can see him on TV walking out. So basically in like a minute. Again, there's a bit of a delay. You'll see him on your TV starting before he starts here. But this is the White House feed. It'll come up in a second and we will hear him speak in a second. So just hang tight because this is on a little bit of a delay. This is the White House feed. But they will be, any moment now, they will be going to him. And then I will get off the screen and shut up. All right, he's about to come out. He's coming out. We're waiting for the White House to go live to him. We're waiting. They haven't gone live. There we go.
Thank you very much, everyone. Thank you. Thank you. Beautiful day in the Rose Garden. Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time, they were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action, today we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country, stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days, and what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Burks, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions, but an automated, high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3% and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1% and 2%. So we want to also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much, Deborah. I'd like to maybe have Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony's been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This is an example of another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the president said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers anywhere in the world, and one of them is Doug McMillon from Walmart, and I'd like to have Doug, if you would, say a few words, wherever you may be. Good, Doug, please.
When we got the call yesterday from the White House, we were eager to do our part to help serve the country, and given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the president described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much, Doug. Appreciate it very much. I'll just stay right over here. And Richard, if you could come up, please. Richard, please. Walgreens, thank you.
Yeah, thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much. Great job. Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Poland? Tom Poland, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
Thank you very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very much.
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr. President.
Thank you very much. I appreciate it. Thanks. And Matt Sauce, please, of Roche. Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible, because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future. which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
Do it. You can do it. Great company. David Pierre of Signify Health, please. Thanks, Dave.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most vulnerable elderly, and through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens, but we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help. LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor.
Thank you very much. Thanks. Great job. And Bruce Greenstein, LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians, as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Good test.
We'll practice that.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest in all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further